Chartha is Mr. Grania on an uplift san Áislann a Chartha because Fashi Rove and Shaw in new. So today we are just going through some squats. So speaking to people, they often say they don't like squats, they struggle to do them, and very often it's up and down to something very, very basic. And generally that is because we haven't actually been taught how to do a simple squat. It is quite a simple basic exercise, but it's only a simple basic exercise if you actually know how to do one. So today I'm going to go through some of the basics on how to do a squat, and then once you master the basics and you're able to do a simple squat, then we can start progressing it and taking it on. So I'm starting here. All I have here is my chair. That's all you really need to have if you want to practice doing a squat. Because what a squat is essentially is sitting down into a chair. So we start with our feet. Our feet start roughly about hip width apart. So when you're looking down from your hips, your ankles are straight onto your hips. So you're just hip width apart. The very first thing you do when you go to squat is you push your bum out. That will keep you right. If you start by bending your knees, you'll often find your knees go forward, you come forward. But if you start by pushing your bum out, it's very hard to go wrong. So you're keeping your upper torso nice and straight. So there is quite a lot of wrong ways to do a squat. What I'll do is I'll show you the right way, and then I'll discuss some of the incorrect forms that I see, the incorrect ways I see people doing squats. So first of all, we'll talk about the right way to do a squat. So you're keeping it nice and straight. So everything from your hips up is nice and straight. Where you put your hands up to yourself, you can have them crossed here in front, you can have them down by your side, you can have them holding onto your hips. Naturally, I tend to come here. I just pass them here in front of my chest. And I'm picking a point in front of me and I'm looking forward. And I'm sticking my bum out, ever so slightly. I'm keeping my back nice and straight, and then I'm bending my knees, going down, sticking my bum out, and then I'm coming back up. And that's it. That's a nice simple squat. The reason I have the chair here, so this is quite a low chair. You can have higher chairs, kitchen chairs, as long as they're stable. So your feet are away from the chair and you're sitting, pushing your bum out. It's just as a guide. You want to go down towards that seat and come back up. And that's it. We're pushing down, pushing that bum out, down we come. Now, to stand up, what I want you to do is push through those heels, the backs of the legs. You're pushing up through. The pressure comes from the heels, not from our toes, comes from our heels. So down we go again, pushing that bum out. Now, pushing through those heels, and we push up. The reason we push up is if we push through our toes, there's very little muscle at the front of our legs. So here we have our shin. So at the front of our shin, for most people, there's very little fat, there's very, very little muscle at the front of our shin. So if we're pushing through our toes, what we're doing is we're pushing all our body weight up through the front of our shins and right the way over the front of our kneecap before we hit the big body of muscle here in our thigh. And that's where we get knee pain from. If you're pushing up through your heels, like so, you have all this muscle here in your calf, and it runs behind the back of your knee, and then it hits your big muscle into your thigh and into your bum. Rather than when it comes up here, it's coming up, first place it's hitting is this knee, and then it's coming up, it's running straight up here, and then it's hitting another big bony mass here in the hip. So the ideal way to do it is, feet hip width apart, start by pushing that bum out. So as you push the bum out, your hips are naturally going to bend. You don't bend here, you just let your hips bend, let your knees bend. Down we go, pushing the bum out. Once you're as low as you can go, pushing the heels up. Now I know I look like I'm going very, very low there. You don't have to go as low. I'm quite happy watching somebody do this. If that's where your flexibility is, that is perfect. And then you push up. Because as you practice it, your flexibility improves, your strength improves, and you'll be able to go a wee bit lower, and then a wee bit lower, and then a wee bit lower. And you'll be able to push up. So it's something you practice. So that's it. Using the chair. So if you're very unsure, you're very uncomfortable, you're afraid you're going to fall over. A lot of people have this fear of falling over. As long as you push your bum out, let yourself go down, let yourself relax into the chair. Then the trick is here. Plant those feet, and we're going to press through those heels. Up we come. No hands. And that's the trick. So this can be done by anybody, so particularly if you're coming back from an injury, if you've reduced mobility, if you're struggling, or if you're in the older category, so if you're an older adult wanting to exercise, using the chair is perfectly good. Now, what I would advise is make sure you have a chair that's not going to slip. So if you're in a carpeted area, you're probably going to be okay. Mind if it's a mat, we just don't want any trip hazards. If, like me, you're on tile, laminate floor, or wooden floor, well, I know I'm not putting too much pressure through this chair at the minute, you might want to make sure that it's up against the wall or up against a chest of drawers or a bookcase, provided there's nothing on it that's going to fall or it's going to fall. So generally up against the wall is the best thing, or up against the sofa. It's going to be quite hard to move the sofa. I would advise against sitting down into the sofa or into an armchair, simply because when you sit down, you tend to sink down into those chairs. They're a lot harder to get up from. So a good sturdy kitchen chair is all that you need. And then you're planting your feet and you're pushing back up again through those heels. And that's it, nice and simple. So you can incorporate the chair into any of my exercise routines if you need it. And then I'm just moving the chair away. So what we're doing here, we're doing feet hip width apart. Generally you have your toes pointed out, but depending on where our tightness is in the legs, some people turn their toes out, some people turn their toes in. As long as it's only very mild, it's not important, but do try start with toes pointing forward. I do have a habit of having duck feet, toes pointing out. I do try and keep them straight. So what we're looking at now is feet hip width apart, and we're pushing down. Down we go, nice and low. And we're going as low as we can, and we're pushing up. Now, did anybody see anything wrong with that squat? Believe it or not, there was. Watch again, watch my feet. So we're squatting down, as low as we can. What you see, and we're coming up. My heels are lifting. If my heels lift, the lower I go down, it means I don't really have the flexibility to go that low down. So to compensate, my heels have to lift to let my bum come down. That is generally due to lack of flexibility. Somewhere at the back of the leg. Generally, it's in the calf muscle here at the back, but it can be from the glutes right the way down to the calf. So what you want to do is you go down as low as you can until you can feel that those heels are starting to lift, and you hold it there, and then you push it up. The reason you don't push past into it to where your heels lift is if you have to do that, lifting the heels, suddenly you're on your toes. How are you getting out of that squat? Unless you're going to rock back, in which case I've had to rock back. See how my angle changed? I'll show you again. So I'm coming down as low as I can, lower than I should. So I'm up on my toes. For me to rock back onto my heels, I'm all out of position. And I'm coming up. I'm putting a lot of pressure there on that lower back because I don't have the flexibility when I go down that low. So what you do is you only go down as low as you start to feel your heels lift, and you stay on those heels and you come up. You do see sometimes trainers or people, they'll put something under their heels to help them. So they'll put generally a weighted plate, or they might put a mat or a rolled up mat or something. So they'll already have that when they start, so their heels start in that shortened position, and then they squat from there. If you're just doing basic squats, that's a bad idea, because all you're doing is training your legs to be in that shortened position. What you would need to do there, get rid of anything that lifts your heels. That's why we always start on a flat surface, that you don't have either your feet, your toes up or your heels up. So what you want to do there is move everything away, and you start and you look at your flexibility. You go down as low as you can until you feel your heels starting to lift, and you pull back ever so slightly, just a couple of millimeters, till you know your feet have contact, and you train from there. And then you look at the flexibility from your hips down. Start with your calves. Generally, 9 times out of 10, the problem is in a tightened, shortened calf. But it will often be from the hamstring and then up here. So generally, you'll be looking at a flexibility program, something very simple, just making sure you stretch your calves, foam rolling, and then you're generally looking at your glutes. Hamstrings don't generally be tight. Hamstrings tend to be overstretched, although they feel tight. They're generally overstretched and they're weak, which gives a similar feeling to being tight. So generally you wouldn't want to overstretch your hamstrings. You want to strengthen your hamstrings, which is what your squats are going to do. But you can have tightness up here in the glutes, and then tightness in the calves. And they're shortened and they're becoming tight, and they're stopping your flexibility. So that's what we're looking at. So that's one common mistake that you can see. Another common mistake when people are doing squats is they just bend their knees like this. That's not a squat. Because all you're doing is bend your knees. Anybody can bend their knees. You're putting a lot of pressure through those knees. You often hear people going, I can't do squats, I have knee pain. Can't do squats, I have knee pain. That's it. I just can't do them. Got knee pain. No, can't do them. The reason you can't do them because you have knee pain is you need to look at what you're doing. So, yes, a lot of people have knee pain. I've been there myself. I can get knee pain. I've hurt my knees more than I care to think about. I've been on crutches from torn ligaments in my knee. So I've been there. But I can still do squats. And I've practiced them. But you have to do them properly. So you have to stick that bum out. And then you let your knees bend. And if you go down here and that pain starts coming into that knee, well, that means that that's too deep for you. So you come out of it. You come to where you know you're going to be comfortable. If it's putting a shooting pain into your knee, then you don't go into it as far. But you still do your squat. Because when you're doing your squat from there, you're going to be strengthening everything up. And then you look at where it's coming from. Is it because you're not pushing through your heels? Or is it a tightness here in the quads? Sometimes we have a tightness here in the quads. When we go into that position, everything starts to pull. And these muscles start to pull on these kneecaps. And they really start to irritate them. Which means, yes, you're going to get a lot of discomfort. And if it's very tight, if there's old scar tissue there, it is going to pull and it will hurt. So what you do is you go to a point where you know you're comfortable and you come out of it. And speak to your trainer and say that I can go to here with my squats and I can't get any further because of knee pain. A good trainer will be able to go to you and look at your squat, make sure you have proper technique and make sure they're not going to give you a gimmick of lifting your heels or raising your toes or anything like that to try and get you to go deeper. Your feet are flat on the floor. And then they're going to look at maybe tightness here, maybe strengthening hip muscles, things like that. So there's other ways around it. But if you're saying because you have knee pain, just get somebody to have a look at your squat. Somebody that will know. Make sure, so another fitness trainer, somebody that will know how you go down into your squat to make sure you come out of it properly. And then another common mistake I see is this, the bow. That's not a squat. What you're doing is moving your hips. But I can see where people think of it. They see the bend. They see when you're going squatting, they see somebody's chest coming forward. What they don't realise is that's a natural progression from sticking your bum out, your chest is going to come forward. But you need to keep that back straight. So you don't start by leaning forward and then sticking the bum out. And you don't start by bending the knees and leaning forward. So bend the knees and lean forward. We bend the knees and lean forward. It might look good, it might look convincing. You're doing nothing. In fact, what you're doing is you're putting a lot of pressure here. Right way around here, so you're putting pressure in the front of the hips, and you're certainly going to hurt that lower back. So we make sure we don't bend the hips. So when you see somebody doing that, the best thing is, or if you think you do it yourself, the best way to do it is to take a video of yourself or have somebody else video, and you'll be able to see quite quickly. You start by making sure you push that bum out, bending the knees then, down we go, nice and straight, picking our point in the wall in front, and up we come. And that's our squat. So that's some of the common failings and some of the basic moves to do it. Once we master that basic squat, there is loads of scope to do it. So once we master that basic squat, you can then start adding in weights. So you can either just hold a weight, you can hold a weight here in front. You see people with their barbells, and you see people here holding up the bar across the front here. And then there's loads of other ways you can lower down and you can start to hold it. Again, if you're not doing a proper squat position, holding this position is hard anyway. But if you haven't practiced your proper squat position and you haven't gone into this position properly, you're going to feel it everywhere but here at the front of the legs and in the backs of the legs. That is a leg movement. It builds up your legs. So that's where you want to feel it. You're holding it, and then you have pulsing, so you come down, you rise out, and come down, and rise out, and come down. Tough one. And up they go. But they're really simple moves. So squat is very important, particularly for basic daily living. So you see, I have my chair. So if you're getting older and you want to remain independent living, you want to sit in the toilet. Very simply, you want to sit in the toilet and you don't want somebody to have to be there to help you get in and out of the toilet. If you can't squat properly and effectively, it can affect your ability to independently live. Same as that's where you then have the aid, so you can always get a handle added in. But again, it's still a basic movement. I'm put down here, and the handle's here at the side. Unless you have somebody that's physically going to be able to lift you up out of that, you're going to be stuck in the toilet. Likewise, in your chair, your armchair at home, I know some of them do go nice and down your nice comfy armchair, and you want to be able to get in and out of it comfortably for as long as you can. So definitely learn a squat, and you're never too old to learn how to squat. It's there from a very young age. We just get other things put into our head and we forget. And it's one of the failings of many of our PE systems, particularly when I was at school. We were never taught how to do a squat, we were never taught how to do a lunge, we were never taught how to do very basic exercise movements. We done plenty of physical education, we done plenty of PE, we done plenty of circuits, we done plenty of running. We did even go to the gym. But we were just told that's a squat, that's a lunge, that's a that, and that's a that. So you just done whatever. You didn't necessarily know you were doing it right, and there was nobody there to correct you. So this is where sometimes you have to pull back, even from years of doing it. And no matter how tall you are, no matter how small you are, you can squat, because it depends on your centre of gravity. So all of our centre of gravity, most of them is here. So that's why if you start to bend over, your centre of gravity isn't straight down, it's out in front of you. So of course you're going to feel like you're going to fall over. So if you stick your bum out, your centre of gravity remains here, remains in your core, and down you go, and come up. But if you're squatting like this, where's your centre of gravity? All of a sudden it's down here. So naturally, you're going to feel like you want to topple over, and up you come. So the best thing to do is, if you feel you're going to topple over when you're going for a squat, make sure that bum goes out first. And just go down until you start to feel like, no, I think I'm going to start falling over. And then you come up, and you train yourself. Once you have the basic movement, we're going to start thinking then about our pelvic floor and our core, because it is important to hold them all together. So we go down. As we go down, we're tightening up our core and we're tightening up our pelvic floor. And we're pushing up and relaxing. So to tighten the core, all we do is we feel for our belly button, and we imagine now somebody is here at our lower back, and they've got a string. The string's attached to our belly button. So to tighten our core, they're pulling that string, and the belly button's tightening up. Now you're not sucking it in, you're tightening, so you're contracting your muscles. So it's like somebody's putting a girdle on, and it's tightening up, starting here, tightening up and tightening up. So you're not necessarily sucking in, you're tightening up. So you're trying just to contract it in. It will take practice. Best thing to do, lay your hands on your belly and practice tightening it in. So you're pulling that belly button back. So it's not necessarily sucking in. When you suck in your belly, everything goes back. It's really just your belly button. You're just tightening it in, and you're feeling just like you're putting on a compression t-shirt or something. You're just feeling it tighten. And that's our core tightened up. And you hold that, and down we go. Take a bit of practice, and up we go. Now, not very easy to do when you're talking, I will say. So you do try and hold it in and coming down. And don't forget to breathe. You will get practice, and you will be able to hold it a little bit longer each time. And then for our pelvic floor. So our pelvic floor is everything between our anus and our front passage. Our back passage and front passage. So that's our pelvic floor. It's all held up inside in here in our pelvis. Now many women know about their pelvic floor because from pregnancy we're always told to mind it. But men can also have pelvic floor issues. It's very important to make sure that we train them and that we keep working them. And a very effective way to do it is when we are doing squats and are doing other exercises where you can just naturally think and train it, because something can't be seen, so you can be training away and nobody knows, or practicing away and tightening up. So all you're doing here is you're imagining somebody you're putting on a pair of jeans and they're very tight, and you're tightening up, so you're tightening up here, putting on a pair of jeans, everything's tightening up. And then you're imagining you're going to try to stop yourself urinating and passing wind. So you're tightening up, everything, clenching up the back passage, tightening up your urinary tract, and there you go. So you go from front to back, rather than just trying to hold it in, you need to go from front to back. Everything, it starts right back here at the back passage and comes the whole way forward, right up to here. So you imagine tightening that up, holding it all up, and then tightening the core, and down we go. And up we go. And it can be simple as that. Just imagine you're just tightening it all up, holding it all in, trying not to pass urine, trying not to pass wind, and you're trying just to tighten it up. We're not clenching, we're not holding it all in like that. It's muscular, so it's nice and gentle. You don't want to make it very obvious that it's not like a big movement, it's very gentle. Just tighten it all up and then tighten the core. And that we can do with that in combination with our squats. If you want, you can practice the core and the pelvic floor independently, and then you can add it into your squats if you can. Even if you started just before you start the squat, you tighten everything up and go down, you realise halfway down that you've let it go, that's perfectly fine. It will be something you'll be able to train. So that's all I want to run through today. That's just our basic squat. So I hope that you find it helpful. If you have any more questions, don't be afraid to get in contact with us. You can leave me some comments, but you can get in contact with me. I'm always about the Áislann, so you can contact the Áislann directly and leave a message, and we'll be able to get back to you. So I hope you all now have a lovely day, and we'll speak to you all soon. Slán!